Oh, glad everybody had to hear that.
Of course. We always talk about poop. We're allowed to.
Hi, everyone. Hi, Patty. Hi, Goldberry. Hi, Joe. Hi, Melanie. All right, handing you over to Gma. We're home. We're home with Evie. Oh my goodness, she slept a lot on the ride and now she's very active. She's very wiggly.
I'm awake.
She's awake. So she made it up here from North Carolina. No incidents. She did very well. Do we have a CC'er?
Not yet. Do we have a CC'er? Anyone? Is anyone able to CC? Bloomer says she can help mod while someone else CCs. Tammy says she'll CC. Just give her a moment.
Okay, all right, okay. Oh my goodness, you are so wiggly. My goodness, Levy. Oh my goodness.
Right,
She's like
Tammy
climbing
says
around.
Tammy says she's ready, but please don't go too fast.
Okay, thank you, Tammy. All right, so this is Evie. She's about probably 6 weeks old now. She just arrived after an 8-hour drive from North Carolina. Evie was at a shelter and on red alert, which means at risk of euthanasia. Oh my goodness. Oh my goodness. I don't know how to control you. See how we do wrapped up in a blanket. Okay. Can we just chill for a little bit, huh? Can we just chill out for a minute? She was on the euthanasia list at the shelter, and one of the staff members at a rescue nearby contacted me about her. They suspected she has hydrocephalus, and this woman, Tiffany, with the rescue, knows a lot about KKP and the work we've done with hydro cats, and she was hoping we could help. So I agreed as long as we were able to get her up here. So in the week that the rescue down there had her, she's had two pretty significant seizures. The first one was around 2.5 minutes, and after that seizure, they brought her to the ER, where she was hospitalized. Little Pixie. So the ER down in North Carolina has a pretty exceptional neurology team. They found a fontanelle, which is the technical term for a soft spot in her skull. And they were able to do an ultrasound through that opening and confirmed that she has excess fluid in her head. Now, if you have been around long enough, you know that Dr. Glass, our neurologist, will not accept that as a diagnosis. He accepts nothing less than an MRI. So I'm still not 100% confident saying, you know, yes, she has hydrocephalus. Seeing her in person, she doesn't have a classically dome head, does she to you?
No.
No, she doesn't to me either. So sometimes, like Jean, I can say 100% sure she has hydro. Looking at Evie in person, I'm not totally convinced that she does. So one of the things that we are going to investigate is, you know, what's going on in her head. She will for sure need an MRI. We need to figure out the cause of her seizures. We need to figure out if there's anything that can be done about the mobility issues in her hind legs. These things could have, and probably do have, neurological causes, and an MRI will tell us more details about whether there are treatment options, surgical options, medicinal options. There's not a lot that we can conclude without having that detailed imaging of her brain. She is on some medications. She's on a seizure med. She's on a couple of hydro meds, and she's on a diarrhea antibiotic. And in the last week, since she started the steroids, Tiffany has noticed some improvement in her hind leg mobility and balance. So that's good news. You might have seen she has a little curlicue tail. It does actually stretch out, so It is kind of a normal size tail, maybe short, but she just has it curled up. It used to be very, very tightly curled. You weren't able to pull it out like this. And since she started the steroids, that's actually one of the improvements, is her tail uncurls a bit if you stretch it out. So there's a lot we don't know about her. We don't know, does she have hydro? We don't know, does she have something else going on neurologically? We don't know if she'll ever regain mobility in her hind legs. All of this is to be determined. But out of all the kittens, neuro kittens we have right now, she's probably the one that we most urgently need an MRI on to be able to treat her properly. So she has an appointment on Monday with Dr. Glass. Hopefully we can get through the next day without any seizures or her crashing, and wait until Monday for her exam. And we'll see what Dr. Glass has to say about next steps. She's gonna be an adventure. She's pretty complex right now. And I have a feeling she's gonna, there's gonna be a lot of mysteries about her that we need to solve. Those of you who were around when Fizzy first got here, you know that Fizz was not able to use her hind legs and stand upright on all fours. And medication and then her shunt enabled Fizz to be able to run around like a regular kitten now. She's not at all restricted by her hind legs. So, we can hope that Evie has a similar transformation with us. Maybe medication will help her, potentially surgery down the line. That we just don't know yet if that's going to be the case with her, but it's a possibility. So, we have a little pen set up in my living room for her down here. I have been told that she attempts to make it to the litter box. She makes it to the litter box maybe half the time. The other half she goes on the pee pads. So we have a litter box ready for her. We have a little bed that's easy for her to get up into. And we didn't need big tall walls because she's not able to climb out right now.
Not right now.
We got to keep little short walls for her. She is still on quarantine, so she was at the shelter about a week ago. She got pulled, so she still has at least another week of quarantine where she can't be around any other cats and kittens. But she also has some pretty wicked diarrhea, I've been told. So we also need to figure out what's causing that and try to clear that up before she is introduced to other kittens. But the plan is that she'll be down here in my living room, for probably quite a while, getting fed, getting her meds, that sort of thing.
I gotta wait too.
Yeah, so I'm gonna get her weight. I'm gonna see if she wants to eat some food. I've seen her. I've been told that she eats pretty well and she has a good appetite. But I have not had a weight on her in over a week. So she was just under a pound when she was hospitalized. So let's see how you're doing. Okay, here we go. Let's see. Oh, wow. 1 pound, 5 ounces.
Ooh.
That was a big gain. Wow, that was a big gain, baby. Good job. Wow, so that was about 5 ounces in a week.
Wow.
You must be a good eater. Yes, you must be a good eater. All right, let me put you in here for a minute while I get your food ready. Don't jump out. I can see her doing that. This is going to get my cats all excited. I don't know if she eats any dry food, but we're just going to try some high-calorie wet food first. All right. Oh, very good. Digging right in. Oh, hi, Fizzy. Fizz has to check everything out.
Fizzy's got to check this out.
I did get another camera, private camera, to keep on her so that I can watch for any seizures. So I'm going to be setting that up. Right now, I do not have any extra computer or anything to set up a public live stream down here. So it's just going to be, you know, basically like, you know, the personal pet cams. She definitely tries to stand up. Let's put this down. She definitely tries to stand up and use her back legs, so she's not paralyzed. If you see, she kind of rolls over on them. Yeah. So that's very, to me, that's very, very similar to when Fizz arrived. She does have some wonky things going on with her eyes. I think when I first met her an hour ago, she had some like white gunk in her right eye, and I've had to wipe it out a couple of times already. So I think we're gonna start some eye meds at least over there.
Okay.
I do not know where she came from. I don't have any, I asked and I did not get any information about a family. I know that she was found as a stray by herself. So, you know, she was not an owner surrender. She wasn't living in a home. She was living outside, and there was no sign of mom or siblings. So her history, the first 5 weeks of her life is a mystery. What questions can I answer? Anybody have questions?
No, you've been answering them, and somebody will ask a question, but then as you talk, you're
Oh, okay.
answering.
All right, let me know if you have questions I didn't answer.
Well, we didn't answer about the eye drops because Jen had already said that we saw what was going on. She's going to be needing eye drops. So obviously, since we just got her, we have not given her any eye drops yet.
She's such a polite little eater.
She is. Really going to town.
Yeah. That's a very good sign.
Yeah, she's really eating.
We were driving back here. It took a little over an hour to get home, and Chima was holding her as we drove back. And at first she was sleepy, and took kind of a little nap. And then she woke up and was whapping at Chima's hair and biting the strings on her hoodie and looking all around, trying to wiggle out of Chima's arms. So she kind of goes back and forth between being really sleepy and then being wild lady.
We have heard her meow a few times.
Yeah.
Yeah.
She's not. I haven't heard her meow like some of the videos that Tiffany posted, where she's like really making a racket. We haven't heard that. She's let out some meows, but not like that. But there are videos of her screaming, so
We haven't heard that.
yeah. We'll see if she wakes me up in the middle of the night, wanting attention. Oh, big sigh.
Oh, right back to eating. Wow. Goodness, she was hungry.
If she didn't have the seizures, I wouldn't be as worried about her. The seizures concern me because the second one she had went for 5 minutes, and we have emergency medication that you use if she's had a seizure for at least 4 minutes. You give her this emergency medicine, and they had to do that to interrupt the seizures. So, that's the only thing I'm particularly worried about, because they are very long. It makes me feel like, we need to figure this out much more urgently than I would like, because she's still so small. Typically you don't want to do an MRI and anesthesia on a kitten who's less than 2 pounds, you know that we've had to do MRIs on kittens who are 1.5 pounds. We've done it. So Dr. Glass is definitely willing to do that. It's just not, it's very risky. But if that's what's gonna help save this girl, then
That's what we do.
we take that risk. But I'm very pleased that she's gained as much as she has. You know, if we can at least get her up to 1.5 pounds, I would feel a lot better about anesthesia.
Well, I keep thinking she keeps eating like this, she'll be up to that 1.5 pounds in no time.
Yeah, let's hope so. Yeah, right? And she, as you saw, she gets herself around by pulling herself and wobbling there, here and there. There's her little curly cute tail.
There's her little tail.
Yeah, I thought originally when I looked at the pictures, I thought it was a bobtail, but it's not. It's not a stump. It actually is like a full tail. It's just curled
It
around.
was just curled.
Where are you going? Look at this big belly. Look at this big belly. I think she's full. All right, so no questions from people? I answered.
Any other questions?
I'm gonna put her in her little pen and look at her just sitting up.
Someone asked if she needed a heating pad.
But I don't have one in there now for her. She's able to, she's old enough and big enough that she can regulate her body temperature. So I think she'll be okay. She's definitely got spirit.
Oh, she does. She has spunk.
I hear Zoe chirping over there. You hear? Zoe wants to know what's going on. You're all full now? Hopefully we'll have a fantastic transformation video of you in a few months. Wouldn't that be wonderful? She's solid gray, true gravy. Not a gray tabby, she's solid gray. So curious. All right. Well, thanks guys for joining. I'll keep you updated. Like I said, I'm going to set up a private cam on her and we'll just get to know her a little bit.
Some people are wondering if snugglers are going to meet her or anything.
I'm not gonna have snugglers handle her because she's still in quarantine. I just can't risk um, them touching her and then accidentally touching, Fizzy or one of my cats. So at least for the next week, she won't be having snugglers. But we'll see after that what kind of needs she has. Yep. All right, guys. Stay tuned for her story. Bye, everyone.
Bye, everyone. Evie, say bye.
Evie.
Evie, want to say bye? Say, here we go. Say bye. Ah, there she is. All right. Bye, everybody.